Health Talk brought to you by Rapides Regional Medical Center. If you've made it to middle age, chances are you know someone who's had a hip or knee replacement, but you're less likely to know someone with a new shoulder.
Hip and knee replacements have been around for quite some time now, and people have gotten very good results with the hip and knee replacement surgeries. But shoulder replacements are a relatively new up-and-coming surgery. There's been recent advancements that have helped provide better results.
Even so, there are more than 50,000 shoulder replacements done in the United States each year, and there are 3 different types of shoulder replacement.
There's a hemiarthroplasty, which is replacement of the ball on the humerus bone or the shoulder bone. There is a total shoulder replacement, which replaces the ball also, but also the socket in addition to that. The other type is a reverse shoulder, where the ball is on the socket and the socket is actually on the ball, but that relies more on the shoulder muscle on the side rather than the rotator cuff to lift the arm.
All 3 surgeries require a hospital stay and rehabilitation after surgery.
Usually you'll be in a sling for about 6 weeks, but you'll still be doing different activities to help keep you loose. We're looking at about 3 to 6 months of physical therapy to try to get you back to about as good as you're going to get. So usually about 6 months or so total.
And though recovery isn't immediate, patients routinely say the surgery is worth it.
Usually for the right indications, for arthritis, for massive rotator cuff tears, patients do very well with these. There are still studies that are looking at the long-term outcomes, but even at 10-year outcomes, 90 to 95% of patients do well.
For more information about shoulder replacement, call 318-443-7622.